You might not think of connected medical devices as critical infrastructure, but they are, and new cybersecurity holes keep opening up in medical devices. The latest ones, though, have the attention of two agencies. From the FDA, the Deputy Director of the Office of Strategic Partnerships and Technology Innovation in FDA's Center for Devices and Radiological Health, Dr. Suzanne Schwartz joins me. Dr. Schwartz, good to have you on.
Good morning, and thank you.
And from the Homeland Security Department's Cybersecurity and Infrastructure Security Agency, or SASA, the Associate Director for Vulnerability Management, Boyden Rohner. Ms. Rohner, good to have you on.
Thank you for having me.
Let's start on this issue of connected medical devices. What is the issue going on that you're finding? There's some holes here in their operating systems, as I understand it, that have really got the FDA worried. Dr. Schwartz?
Yes, FDA has been working on the issues of vulnerabilities identified in medical devices, particularly connected medical devices, for several years now. And our posture has been one of leaning forward so that as vulnerabilities are learned about, as they are brought forward to the agency by different researchers and other parties, we look to do a pretty comprehensive assessment of what its impact would be on the functionality of those devices and therefore on its effects on human lives. So as vulnerabilities most recently came to our attention with respect to a package called Urgent 11, we mobilized in getting a better understanding of what its potential impact could be, working with others within the ecosystem and notably with our partners at SASA as well.
And Ms. Rohner, the critical infrastructure concern of your directorate, a medical device initially would seem to be, well, that's me and my doctor, and if someone hacks it, I'm in trouble. But how does this add up to the larger picture that SASA looks up of the national critical infrastructure?
Absolutely. Well, SASA is responsible for looking across all 16 sectors to find commonalities and then find ways to reduce the risks in ways that transcend the different sectors, public health being one of them.
And so what does SASA bring to this effort that FDA is dealing with, this Urgent 11? Urgent 11 sounds like something you would call out on a hospital intercom.
In this specific case, there were 11 specific vulnerabilities that were identified that are in operating systems that were used by a number of medical devices. And SASA brings the technical expertise for IT and industrial control systems vulnerabilities. We work closely with the security research community to bring their findings to the attention of the manufacturers or the vendors, and then work with them to find a way to patch or remediate the vulnerabilities the security researcher communities found.
And Dr. Schwartz, what's the nature of the devices and how many are there, do we know, out there in the ecosystem? And what could be the effects if someone were to hack into these operating systems? Or what does Urgent 11 do? What's the danger to the patients?
Yeah, it's important to note that Urgent 11 affects operating systems, broadly speaking, well outside of the medical device and healthcare ecosystem. So I do want to point that out, and that there could be lots and lots of consumer types of devices or devices that absolutely have nothing to do with healthcare that are actually also impacted by Urgent 11. FDA became aware of the concerns around particularly devices that have these operating systems that are in the medical realm and that are specifically under our own oversight, and they span across many, many different types of medical devices. It's very hard to put a number behind the magnitude of it because, again, we're talking about operating systems that are pretty ubiquitous, and what makes this one particularly difficult is that the discovery of the type of third-party software component that's involved in this particular set of vulnerabilities is still in the process of ongoing discovery. And so as we learn more about it, there could be even broader impact across multiple medical device manufacturers.
We're speaking with Dr. Suzanne Schwartz, Deputy Director of the Office of Strategic Partnerships and Technology Innovation at the Center for Devices and Radiological Health at FDA, and Boyden Rohner is Associate Director for Vulnerability Management at the Homeland Security Department's Cybersecurity and Infrastructure Security Agency. But is it in vulnerabilities in pacemakers? Are they in dialysis machines? What are some of the medical possibilities?
They could be in different types of equipment, not pacemakers. We're talking about more capital type of equipment investments that are made by hospitals, different types of monitoring equipment. And what I would advise, what FDA has advised in the safety communication that we issued, is that one keep a close eye on the postings that are being made by medical device manufacturers and that are also incorporated on the SASA bulletin that represents kind of a rolling notification of medical devices that could be impacted and what the appropriate steps or mitigations are in order to avoid those vulnerabilities from being exploited.
And Ms. Rohner, how does the word get out? How do you mobilize the industry? Because it sounds like a disparate bunch of companies involved here.
Yes. Well, the first thing that we advise anyone who is in the IT or community is to sign up for alerts from the SASA website. That's where you'll get real-time notifications and updates to previously published alerts and bulletins that we write based on our interaction with the security research community or the sector-specific agencies, in this case FDA. And so we would encourage all of our customers to go there and sign up for our alerts.
And is there any evidence that anyone has exploited this weakness, this vulnerability? And if not, have you had a chance to maybe study it, find out what its lateral movement plans might be, or maybe it's sitting there waiting in wait and it'll activate sometime down the line? Have you had a chance to really analyze it? Dr. Schwartz?
FDA isn't aware of any exploitation of this vulnerability, certainly not within the medical device or healthcare ecosystem. And that is something that we are continuously monitoring for with the close coordination that we have with healthcare organizations, with Department of Health and Human Services, and through our communication in the Healthcare ISAC, the Information Sharing Analysis Center as well.
And Ms. Rohner, it sounds like if it's something that is not confined just to medical devices, there could be that lateral movement. Has SASA been looking at that?
Yes. I mean, that is a big part of what the expertise that we bring is doing that research to see how these could be exploited. To my knowledge, these have not been exploited, and at this point, aside for research purposes. But yes, that is exactly the purpose that we serve in this ecosphere.
And my understanding is that medical devices are often pretty much behind the times when it comes to operating systems. The manufacturers work on functions of the devices, but they don't really get deep into the IT very often in terms of the latest and most secure operating systems. Do you think this will maybe spark a change in that way of that industry?
We're seeing changes every day in the industry to be more security focused. In the case of medical devices, some of them were conceived of before they were heavily networked, before security was as prominent in people's minds as it is now. So we're seeing positive trends in that development.
From FDA's perspective, we've seen a fair amount of progress over the past several years with our issuing of policy and representing what it is that we expect to see of manufacturers as they design new devices, what type of security, how rigorous that security needs to be as being built in from the onset of a new device development. And I think that with Urgent 11 and other types of broad vulnerabilities that have been brought to our attention, there's been greater awareness and a recognition that we cannot be reactive. We really need to be forward thinking and proactive in addressing these issues before an attack actually occurs.
Dr. Suzanne Schwartz is Deputy Director of the Office of Strategic Partnerships and Technology Innovation at the Center for Devices and Radiological Health at the FDA. Thanks so much for joining me.
Thank you.
And Boyden Rohner is Associate Director for Vulnerability Management at the Homeland Security Department's Cybersecurity and Infrastructure Security Agency. Thank you also.
It's been my pleasure.
We'll post this interview and a link to more information at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive at Apple Podcasts or Podcast One.